Hello, my name's Ian Pavord, and I'm delighted to provide this video summary of a paper published in the International Journal of COPD entitled Mepolizumab for eosinophil-associated COPD, analysis of METREX and METREO. And I'm presenting this on behalf of my co-authors listed on this slide. I have some relevant conflicts of interest as set out on this slide. Now, why was the study important? Well, METREX and METREO, which evaluated mepolizumab versus placebo in patients with eosinophilic COPD who had an exacerbation history despite maximum inhaled therapy. One study met its primary objective, but the other didn't. So this meta-analysis allowed us to provide a more robust estimate of the effects of mepolizumab versus placebo in this group of patients. Both studies were phase 3, placebo-controlled, double-blind, randomized, multi-center studies involving patients with COPD and blood eosinophil counts above 150 cells at screening or more than 300 at some point in the last year who had frequent exacerbations despite inhaled steroid-based triple maintenance therapy. The analysis I'm going to show focuses on 100 milligrams of mepolizumab subcutaneously every 4 weeks for the 52-week studies. This is the primary outcome, which is moderate and severe exacerbations and annualized. And you can see an 18% reduction with mepolizumab 100 milligrams. And if you look on the right, the time to first exacerbation was also significantly longer in mepolizumab treated patients versus placebo. This slide summarizes what I think is one of the most interesting findings, and it looks at the relationship between the effects of mepolizumab versus placebo on the primary outcome, moderate to severe exacerbations, by baseline blood eosinophil counts. On the left, you can see all moderate to severe exacerbations, and on the right, those treated with oral corticosteroids, whether with antibiotics or not. And particularly the analysis on the right show a clear relationship between the clinical benefits of mepolizumab on this important outcome and the baseline blood eosinophil count. In conclusion, mepolizumab reduces exacerbations in patients with eosinophil-associated COPD, and the blood eosinophil count aids identification of patients with COPD who experience exacerbations while treated with maximum inhaled steroid-based triple maintenance therapy, who are likely to benefit from the addition of mepolizumab. Further studies are necessary to assess the efficacy and safety of mepolizumab in patients with eosinophilic COPD. Thank you very much.